Good morning, Southeastern Idaho. I'm Benjamin Farnes with Local News 99. We start again with an update on the Wasatch Wobble. Thankfully, there are fewer deaths than expected from the earthquake and only one major aftershock. The deaths are being handled by local authorities. Responders are focusing on establishing temporary medical facilities, with medical shelters arriving from Wyoming and local health districts 6 and 7. Additional resources deployed to the area include staff from hospitals and volunteer organizations, mass casualty trailers with cots, blankets, and other response supplies. Devin Hughes is the Operations Section Chief at Southeastern Idaho Public Health. He's on the phone to tell us about medical shelters. Devin, what are these medical shelters and how many people do they support?
So these medical shelters that we have, they hold ours from Public Health District 6 over here in Pocatello. We hold 25 regular as well as 5 bariatric. And then the Idaho Falls, that's also over here assisting us, they hold 25. And there's actually a pediatric focus, so they can receive children into their medical shelter. And the medical shelter is a little bit different than what a hospital can support, and then also what a general population. So if it's something like an acute patient, somebody that needs a really big emergency that needs to take care of course, they go to the hospital. But somebody that needs some additional support, like maybe they have chronic diabetes or something like that, they can come to this medical shelter and we can support them. And this really helps us, or helps out the area, so that there's not as big of a patient load over at the hospital. So it helps out the hospital with that patient load, and then we can support some of the population there at the medical shelter.
What's your assessment of how the aftermath is being handled?
Well, of course, in a case like this, I mean, there's always a lot of stuff that's going on. But right now, I think everyone's handling it very well. We've worked together. The hospital is setting up their alternate care sites. We also have these medical shelters, so we're trying to add additional beds to help support the population. So I think everything's being handled pretty well right now. We're working really well together. Relationships have been built before, and so that if there ever was an event like this, we can start working together. Also thank all the volunteers that are helping us out too right now. But right now, things are running pretty good, and we're just grateful for that.
Thank you, Devin. As resources arrive into the area for support and residents start cleaning up, the questions move from recovering from this earthquake. To give a look ahead, we have Greg Hackett from Southeastern Idaho Public Health. Greg, where do we go from here? How do we determine the way ahead?
Looking forward, tomorrow we're going to have a meeting of all the affected counties, Bear Lake, Franklin, Power, etc. We're going to meet at Idaho State University to discuss the path forward. How are we going to get back to normal? How are we going to do it immediately? What's our goals immediately, short term? What's our goals near term, in 3 to 6 months? And then long term, 3 and 4 years down the road, to get back to a normal life.
Thank you, Greg. We look forward to hearing about the planning ideas that come out of that meeting. I'm Benjamin Farnes with Local News 99. We'll be right back.